My name is Kayla Anderson. I'm a paramedic for a public hospital here in the metro area and a proud member of CWA Local 7799. I've been in emergency medical services for 11 years, and I genuinely love the work that I do. I take great professional pride in helping people in crisis, meeting them where they are, and working together to create a plan to get them the care they need. Healthcare workers believe that every person who comes to us for care should be treated with dignity and compassion. We believe every patient should receive the best care possible so they can return home safely. We care about the well-being of our communities, running vaccination clinics, filling gaps in home health care, and trying to make sure that our most vulnerable populations get the care they need. But our care and compassion alone can't fix a healthcare system in crisis. Every day, we hear the news of strained hospitals running out of bed, emergency medical systems running out of ambulances. What goes unsaid is that we actually have plenty of beds and ambulances. We just don't have enough trained healthcare providers to staff them. There is a great deal of reporting in Colorado and nationwide about the ongoing mass exodus of healthcare workers. What they often fail to report is how administrators are directly responsible for creating the dire conditions that drive healthcare workers to leave. At my hospital, these problems are being caused by administrators who are out of touch with the realities healthcare workers have to face every single day in ambulances, emergency rooms, and intensive care units. There is no reward for experience because wage increases are limited to a maximum of 3% per year. Meanwhile, starting wages are increasing as managers scramble to replace the workers they're losing, and administrators give each other raises of up to 29% on their already bloated salaries. More experienced paramedics provide better care, yet we're asked to train brand new paramedics who sometimes make more money than we do. The message we are being sent is clear. If you want to be paid for your experience, look elsewhere. These failures to address retention mean overburdened emergency rooms often tell us that they cannot accept more patients. But when every single hospital in the metro area is saying the same, we still have an obligation to help patients get emergency care. Our dispatch has created a rotational system to evenly distribute patients, but this disrupts continuity of care, preventing patients from going to hospitals where they've been seen before or have insurance coverage. This lack of choice impairs our ability to take the best care of our patients, overriding our professional judgment in ensuring that patients go to the most appropriate facility. It also discourages some sick patients from going to the hospital at all. You'll also notice I haven't said the name of the hospital where I work. That's because, for all my employers' talk encouraging healthcare professionals to speak up about safety concerns, the ones who do are ostracized, denied promotions, threatened with termination, and sometimes outright fired. They could still fire me for speaking to you all today, even though I'm saying the same things that countless healthcare workers across the country have been saying to anyone who will listen for years, long before the pandemic started. Many Coloradans would be shocked to learn that these conditions are not happening in a private, for-profit hospital. The hospital I work for, like so many of Colorado's major hospitals, is a nonprofit controlled by a public hospital authority. However, many public hospitals across the state still operate as if they are trying to maximize profits, treating vital staff as disposable in the name of cost cutting, even at the expense of safe staffing ratios. That means even more patients per provider, worse health outcomes, longer waits for ambulances, and more demands being placed on healthcare workers who are already regularly working to exhaustion to get our state through this pandemic. Many Coloradans would also be shocked to learn that because I work for a public employer, my labor rights are heavily restricted. My employer does not recognize our union, but a paramedic doing the exact same work for a private employer is allowed to join a union with collective bargaining rights. Collective bargaining allows workers to bring forward shared concerns as a group and work with administrators to fix them. We share the same goals. We all want our hospital to be the best place to give and receive care, and frontline healthcare workers who take care of patients every day have so much to offer. But because I'm an public employee, I don't even have that choice. Neither do the nurses, technicians, or physicians I work with every day. Neither do the more than 250,000 Coloradans who work every day to provide the public services that we all rely on. I support the Public Employee Collective Bargaining Act because it provides the opportunity for a real seat at the table to people providing life-saving care to patients daily. I want to thank leaders Eskar and Fenberg for sponsoring this bill, and I hope other Democratic leaders and Governor Polis are listening to the voices of the essential workers across our state who are speaking up about the urgent need for this bill. We are all counting on you.